All right, let's get into pathophysiology. So the book has a little intro and then they talk basic terminology and then they have more about it. I like to do basic terminology as the third lecture. And the second lecture, I do have information about levels of evidence that is not in the book, but we're going to talk about it anyway. So, pathophysiology, our learning objectives, we're going to talk about some cultural, ethnic, geographical, and age-related differences regarding health and illness. We're going to look at the ICF disablement model and define terms associated with it and discuss its relevance to physical therapy. We'll talk about this again in the fall in our classes there because there's certain levels of the disablement model that we can affect and other levels that we can't. So let's affect what we can. Sound good? And you should be able to explain the role of pathophysiology in the diagnosis and the treatment of disease. So why as PTAs, do we need to study pathophysiology? First of all, you need a solid understanding of anatomy and physiology. And I know that a lot of you have taken just the first part of the course sequence in anatomy and physiology and haven't taken the second part. I will try to make sure we review those different systems and their function, so you're not missing out on anything. You need to be familiar, though, with the diseases and conditions that require PT intervention. So it's not always an orthopedic injury that we're dealing with. We're dealing with other diseases and medical conditions. You need to recognize the impact of medical comorbidities on the physical therapy plan of care. That's pretty important. You have to understand the pathophysiology and how the physiology clarifies how various diseases progress and impact bodily functions. So, anytime you get to the point where your cells are out of whack enough that you have a disease, that affects the function of your body. And so, how is the disruption of homeostasis going to lead to altered function? We also need to be able to communicate within the healthcare team. So, we need to have the terminology and the knowledge associated with that. And we need to be able to make a thorough assessment of a patient's medical history so we know how that is going to affect their therapy treatment. So, homeostasis, as you probably know from anatomy and physiology, is the maintenance of a relatively stable internal environment, regardless of external changes. So, even though it's a little bit cool outside today, when I go outside, I'm not going to um, my temperature is not going to adjust to the outdoor temperature because I'm not a lizard. I'm a human. And so my body's going to manage that. When homeostasis is maintained, good health is generally maintained. When homeostasis is not maintained, disease may develop if you're out of homeostasis for long enough. And as you probably know from A&P, homeostasis is generally controlled in negative feedback loops. So you have a receptor, you have your control center, and you have an effector. So the receptor detects the change, sends the information to the control center. The output is sent via the efferent pathway to the effector as a response to the change, and homeostasis is maintained. So we're working in a range, a normal range. And that negative feedback loop kind of keeps us, there's a little bit of up and down, but it keeps us within that healthy, disease-free range, ideally. That's what should happen. So there's lots of different definitions of health and disease, but we're going to say in general that health means physical, mental, and social well-being. Makes sense, right? Disease is when you deviate from the normal state of homeostasis. So you obviously don't want that, but it happens. So we need to know how to deal with it. The normal values of health indicators occur within a range, and they might vary depending on the technology used for measurement. The example that I always use is in the early days of COVID, when everything was shut down except the hospital, we still had to go in. You can't just close the hospital. So we had to go through this screening as we were going in. and I only live a few blocks away from the hospital where I work. And I'd walk over there, and it was whatever it was, April, early April, and so it was still pretty cool outside, especially at 5 o'clock in the morning. Going over there, and so they had the little temperature thing that they do on your forehead, the little temperature sensor, and they tested me, and my temperature was like 56 or whatever, because apparently I am a lizard, but no, because I was outside walking in the cold. And then they tested me in a different location. They tested me on my like on my manubrium, and I was normal temperature. So it might depend on the technology they use for measurement. Probably if they did an oral temperature check, it would have come up with a different number for me. Adjustments can also be caused by other things that you really can't change that easily. Age, the very old or the very young are going to have different norms than the mid-range. So I'm not going to expect the same lab report from a 5-year-old as I do from a 75-year-old, or from a 25-year-old and a 75-year-old. And I'm not going to expect the health indicators to be exactly the same. There is a difference for gender. So hormones definitely have an influence on some of our health indicators. Some of our lab results, like hematocrit is a good example, which is the percentage of red blood cells in your blood. The norms for males are higher and the norms for females are lower. So if you saw me with a certain hematocrit, you'd say, well, that's okay. But if you saw that same thing on a male, you'd say, well, that's a little bit low. So your gender affects that. That for your genetics certainly affect it. So I'm going to have a different response to somebody with a different genetic makeup. Your environment affects it. So there's my, walking outside in the cold and my temperature ranges differently. Or let's say I was in Arizona and it was 115 outside. Mm. Um, how's my temperature going to register in that case? I'm probably going to have a grumpy look on my face too. Your activity level is going to change your health indicators. So somebody who is more active or who is an endurance athlete might have different norms for their heart rate and blood pressure than what you consider to be the regular. Um, if you're very sedentary, your norm might be a little bit different. So a lot of times I'll be assessing somebody's vital signs or something, and I'll say, is that normal for you? Because normal for me might be different from normal for you. There are some risk factors for disease that are 100% controllable. There are a lot of risk factors for disease that are not controllable. So, either some of the factors that affect health and well-being are either not in our control at all, like your age. Your age is your age. People like to say, oh, what, 60 is the new 30. That's not true. But speaking from personal experience, 60 is not the new 30. But you're 60. Your body has been functioning for 60 years. That's your age. It is what it is. The only alternative to aging is dying. So, you know, I'm okay with it. So you can't control that. You are the age you are. Sex, you have to go to extreme measures to change that. Your ethnicity, your cultural beliefs and practices. So in the book, it says that, most Caucasian Americans trust the Western medicine model, and we go with that. People from other cultures might have different ideas about health and wellness. And in fact, they do. I know the first time I ever had acupuncture, it was for tendonitis. It was like a really stubborn, horrible tendonitis that I was having trouble. And I had gone through all my typical Western medicine interventions, including physical therapy, and I wasn't getting any relief from my tendonitis. And one of my friends suggested that I go to acupuncture, and I was very skeptical. So it wasn't in my range of things. And so I went because, I just went, and it really helped a lot. I was like, okay, well, some people say it's the placebo effect, but I was completely skeptical and did not think it was going to work. So So I asked the acupuncturist, can you recommend a something that I can read so I can learn about how this works? And the acupuncturist recommended a book which I read, and I still don't understand it. It's not carved in stone anywhere that I'm going to understand everything, but there was just a little too much of a disconnect between the Eastern theories about health and the Western theories about health that I'm used to. So that those cultural beliefs and practices can differ a lot and can change your perception of health and wellness. Your geographical location, certainly. It could just be what resources are available to you in your geographic location, or weather, climate, other factors, and your socioeconomic status. Unfortunately, the people from a lower socioeconomic status tend to have more poor health, and there are a lot of factors involved in that. The in the book, there's a link to an NIH video that is not available anymore. So some of the videos have been taken down since the book was published, but there's still some good information on the National Institutes of Health website, but you have to dig for it. It's not as easy to find as it used to be. So that just know that that is a less easily controlled risk factor. It's not uncontrollable, but less easily controlled. So this is from a different source, but the 7 steps for health. Um, Smoking, I don't think it's a newsflash to anybody that smoking is bad for you. And secondhand smoke is also bad for you. So don't do it. Be a non-smoker and avoid secondhand smoke. Eat 5 to 10 servings of vegetables and fruit a day, and choose high fiber, low fat foods, and limit alcohol intake. So I'm working on it. I'm working on that. Physical activity on a regular basis. Okay, that's our wheelhouse in PT. Protection from the sun, even in Washington, even in the shady side of Washington, we have to protect ourselves from the sun and follow cancer screening guidelines. Doctor or dentist visit if any changes in the normal state of health, and following health and safety guidelines at home and at work, and when using and storing and disposing of hazardous materials. So during the COVID time at the hospital, we were disinfecting more, and some of the people that I worked with called the disinfectant that we use the kidney killer because it's a hazardous material. Disinfectants are hazardous materials, so you have to be careful. Wear gloves and all that stuff when you're using and storing and disposing of hazardous materials. So the Office of Disease Prevention and Health Promotion, which is also difficult to get to these days, but you can find the information if you dig, has what they call the 5 social determinants of health. So these are all social things that can affect health, and they all make sense when you think about it. But economic stability, so factors like income, employment, and access to affordable housing can obviously affect health. Education, access, and quality. So literacy skills and access to quality education and access to information. So access to information is really important. And so think about that when you're clicking on links that don't work. Healthcare access and quality. So the availability and affordability of healthcare services and access to preventative care and the quality of medical treatment. So that is a big issue. And availability and particularly affordability of healthcare. Some people don't get preventative care because they can't afford it. And that's unfortunate. The neighborhood and built environment, the safety and quality of housing, access to healthy food, availability of green spaces. I feel like I live in an idyllic place where I have lovely green spaces available to me. I can walk everywhere if I want, good public transportation. Um, it's a great neighborhood, access to healthy food all over the place. So not every neighborhood is like that. Social and community context, the social support, the sense of belonging, and access to community resources. That's important for health. So all of these things play into the health of an individual, and a lot of times we don't think of it But it's not just medical. There's a lot of social determinants of health as well. So the International Classification of Functioning, Disability, and Health, which is also known as the ICF, um, in recent years, people realize that there are a lot of things, social determinants and controllable and uncontrollable risk factors, and other things that contribute to our state of health. Or do we have a disorder or a disease, or are we healthy? Or are we on the verge of a disorder or disease? So our body functions and structures are basically our anatomical parts, such as our organs and our limbs and their components. So some of it is just plain old genetic. You're, it's what you're dealt. You might be like in my family, the thing that kills people in my family is heart attacks and strokes. So I have to be particularly aware of that because they're coming to get me. I can't change that. I can't change my genetics, but I can change my activity level. So, activity is the execution of a task or action by an individual. The activity level is also an area where we can affect things in physical therapy. Participation is involvement in a life situation. So, maybe people just, I've definitely talked with people who say that, oh, well, this risk factor runs in my family, but I just don't want to know. I don't want to get tested. I don't want to know. So they're not participating in that part of their healthcare, in the preventative part, because it's overwhelming to them, maybe. We can influence that a little bit too by educating our patients and helping them figure things out. There's certainly environmental factors um, that make up the physical, social, and attitudinal environment that we live in and conduct our lives, and personal factors like your age and your cognitive status and your personality. So some people are the personality that want to know everything, and other people are the I don't want to know people. So that's just who you are. So some of these things we can affect, and some of them we can't. And so it can be frustrating sometimes when you can't help everybody, but you can do your best.